Good afternoon, everyone, and welcome to episode 300 of the On Air Advocate, where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate, and I am super excited if you are joining us or tuning in today and listening in, or whether you are catching this on the replay. Now, as always, if you think any of the content could be valuable for anyone in your network or your circle, please hit the share button and share the love with others. Well, if you guys have been watching our latest series that we have been doing on bile duct cancer, you will know the different rarity in the research that is being done for this condition. And so I am so excited today to welcome to the show Dr. Javle. I am so excited to have you here today for you to share more about this condition, getting to know the condition, all of that. But this is your first time here on the show, and I would love for you to share with the audience just a little bit about yourself before we get going.
Well, Tammy, first of all, thank you for doing this. This is a wonderful opportunity for us to highlight this uncommon cancer. And I want to say that this is often called as bile duct cancer, but it has many different terminologies. It's also called cholangiocarcinoma or biliary cancer. So it really means the same thing. My name is Milind Javle. I'm a medical oncologist and a professor at MD Anderson Cancer Center. And I've been working in this field for the past 10 years. It's been a wonderful experience because when I started, really, there wasn't much that we could do other than some old chemotherapy drugs. Now there's great opportunities. There's a lot of excitement and research. And this disease is probably one of the models in precision medicine. So I'm very appreciative that you're featuring it on your program today.
Yes, and there is so much to learn about this, and in doing different parts of the series so far and just taking little pieces of it, definitely looking forward to kind of diving into this more with you. Now, with the foundation, before we, go on to that, how did you get involved with the foundation?
Well, the foundation was set up by Stacy Lindsay, who is their CEO, president, and she really turned into what was a personal loss, into a personal story, into an advocacy group. And I remember when, 10 years ago, she approached me, her group approached me, because they knew that MD Anderson was one of the leading centers for treatment of this disease. And asked if we could work together. And this was just a handful of people at that time. We met in Salt Lake City for the first time in a university inn, a small group of people, most of whom were really her family. And then some researchers, investigators. That has now evolved into really the leading advocacy for this disease worldwide. And through the efforts of the Cholangiocarcinoma Foundation, now this is a model for all rare or uncommon cancer types that exist. So I'm very proud to be on this journey with them and really admire the work that the foundation has done so far.
Yes, learning about all of the resources and supports they have is pretty amazing for the rarity of this condition as well. Can you take us, if someone's catching this as like their first episode, they're listening in, maybe they didn't catch other parts of the series. We really want to get to know the condition. So can you explain exactly what happens with this bile duct cancer?
Well, let me go back to the kind of explanation that I use in my clinic for a patient who is newly diagnosed. I mention it to them that the liver has a series of bile ducts, which are, in a sense, the plumbing of the liver. And they carry the bile from the liver to the intestine, and the bile then helps the food to be digested. Now, the liver is also the detoxifying machine of the body. So all kinds of toxins that we get exposed to get detoxified in the liver and then carried through the bile duct. So as you may imagine, the bile ducts are exposed to a lot of toxins. So continued irritation of those bile ducts in some patients, they lead to inflammation and then consequently cancer. So these cancers are increasing in incidence, unfortunately, because of various etiologies and various risk factors that we'll discuss. And it is one of the cancers that is rapidly rising all over the world. Although it remains infrequent, although fortunately it remains rare, the burden of this cancer is increasing. So this cancer can arise from bile ducts that are within the liver, that is called intrahepatic cholangiocarcinoma, or bile ducts that are outside the liver going to the intestine, which is called as extrahepatic cholangiocarcinoma. So our goal is to prevent the cancer, to detect it early and treat it effectively.
And is there a demographic, adults, children's age, race, that seem to be most affected by this?
Yes, a very good question, Tammy. This disease, until now, was really limited to the Asian population, particularly Eastern Asian patients who have been exposed to hepatitis or a liver fluke, a kind of parasite that can be acquired by eating raw or uncooked seafood. They had a higher risk of developing bile duct cancer. But with time, we realized that there were other groups of patients who had fatty liver, which is associated with obesity or being overweight. That irritation causes bile duct cancer. And there's also a younger group who have primary sclerosing cholangitis, ulcerative colitis, inflammatory bowel disease that have a risk of developing this cancer. So the demographic includes generally older patients in this 6th decade of life or 7th decade of life, a little more Eastern or Asian than Western or Caucasian. And within our patients in the United States, you're more likely to see patients who are female, some patients who may be overweight, or the younger group who have inflammatory bowel disease.
Okay. And are there things that you can actively do to help in the prevention of this?
Definitely. So the preventive causes of bile duct cancer include alcohol, include hepatitis, include obesity or being overweight. These are some of the risk factors. Now, I wouldn't call inflammatory bowel disease, ulcerative colitis, or Crohn's disease as a preventable cause of bile duct cancer, but certainly we can perhaps identify that as a high-risk group and screen those patients and find these cancers earlier.
Okay. And how does that process go? You know, how does someone, especially with the rarity of the condition and people not knowing about it, what would be some signs or symptoms that would lead someone to even think that they had this, or for their doctor to explore it? And then I guess a second question onto that is, with there not being as many doctors that specialize in this, will those doctors know, you know, that condition, that it could be that condition?
Well, you highlight a very important problem here, because unlike, say, colon cancer or breast cancers, which are more common and have screening modalities and, like mammograms and colonoscopies,
Yeah.
the infrequency of this cancer doesn't make it suitable for this sort of surveillance and screening. So symptoms and signs that one can look for are, for instance, elevated liver function tests. So often people go to, for a sort of an annual physical exam and find elevated liver function tests, and they write it off to, say, a lipid lowering medicine or something like that. These need careful follow-up. Unexplained weight loss, unexplained abdominal or upper right-sided discomfort. These are yellow darkening of the urine. These are some of the more subtle symptoms that one can look for and draw one's attention to visit with their family doctor and get the appropriate investigations.
Okay. And then the hospitals or medical centers that are doing the top research on those, where are those in the US?
So I think fortunately right now there are several. I would say all of the what we call NCI designated comprehensive cancer centers. That is, these are cancer centers that have a certain requirement for clinical care and research and development, carefully labeled as NCI comprehensive cancer centers. I think any of these, which may be in your area, are appropriate sites for treatment for this disease. Of course, there are several that have been treating these cancers for a long time and clinical trials, but I would start with those. Find a nearby NCI comprehensive designated cancer center, and that would be a good place, besides, of course, your local oncologist, to get a second opinion, to have someone else also weigh in into this case.
Okay, and I know that in the other parts of the series, talking to the organization, they do have kind of support where they can help you in that if you think that this is what you have, possibly getting to the right area and the right information needed. Now, research-wise, where is this research-wise right now?
Well, I think this is a very exciting area, exciting time for research, because this cancer, unlike many other cancers, has a lot of actionable genetic mutations. So let me explain that. Now, all cancers have disordered genes, and we can detect them. But unfortunately, most of those genes cannot be targeted by specific drugs or specific therapies. This cancer is one in which the altered genes, the mutations, can be actually targeted by several drugs that have been either approved or in development. So that has created, incentivized a lot of research in this disease. A lot of pharma has expressed interest. In addition, there seems to be a signal with immunotherapy. A recent trial suggests that there may be advantage to using immunotherapy in some patients. So clearly, there's the trajectory finally is on our side, where we have a lot of exciting new developments.
Yes, and have with this cancer, what is the life expectancy with it?
Well,
Or is it not in that realm? Is there, because there isn't treatment for it? I guess what the better question would be, what is the prognosis for it after you get the diagnosis?
So since most patients are diagnosed at an advanced disease stage, often patients are not diagnosed early. The prognosis for with standard chemotherapy that is used in this situation is actually quite dismal. It's about a year and a half, for an average patient diagnosed with metastatic cancer treated with standard chemotherapy. But I like to tell my patients this is an average. There is no average. These data are based on thousands of patients treated all over the world with all kinds of treatments. So now, with the advent of molecular profiling, targeted therapy, modern multidisciplinary care, patients, even with advanced disease, can live for several years. Very often, we can't cure the cancer, but we can still control it for a long time in many.
Okay. And as research is advancing, obviously that will lengthen, as there becomes more advances that way. With the bile duct cancer, is there anything else that you would like the general population, to know about this rare disease that we haven't already covered? That if you could spread the word about something, what would that be?
Well, I think this cancer is a good example of how a healthy lifestyle can make a difference. This is not to suggest that people who have got this cancer have led an unhealthy lifestyle. However, the biggest risk for cancer at this point after smoking is obesity. And we are facing a big epidemic in our country, big epidemic worldwide. So I think those sort of lifestyle choices may be in our favor. That may be something that we can do to prevent these types of cancers.
Right.
But also the point to remember is that although this is an uncommon cancer, it's not that rare. There's about between 10 to 15,000 patients a year diagnosed with bile duct cancer in the US every year. And it's important that we keep our risk of, the index of suspicion high in susceptible population, so that you can guide your doctors and you can ask the right questions, so we can find it at a relatively early stage.
Okay. And from the organization's standpoint, what are some of the things with the organization that you think are such valuable supports to the community, that they offer? I mean, just so that we cover it in this, in case someone doesn't catch a different episode, the different layers of things that the organization has.
Well, the Cholangio Foundation has really done an incredible job in bringing awareness to the community, bringing providers to the table, bringing researchers to task, liaisons with NCI, regulatory bodies. So I think that they have provided a valuable insight into this disease. I would encourage patients to check their websites. I work with this foundation for several years. I'm on the medical advisory board. I refer patients and I look up myself if there's new developments to see on the website. This is a good resource that you could use for finding information about this disease for yourself as well as your loved one, finding appropriate healthcare and making appropriate healthcare choices.
Yes, well, and like I said, in all of our other segments that we've done in this series, is that we are going to drop all of the information below. So whether you're viewing this on video or you're listening to the podcast, we will have all of the links so that they can access that website and get there and see all of the different supports and services that are there and offered. And before we sign off, Dr. Javle, is there anything else you'd like to leave the audience with?
I'd like to leave the message of hope. I want to say that if you are a patient or a family member diagnosed with this cancer, yes, it is serious. Yes, the prognosis can be tough. Yes, maybe we can't cure it, but there is hope. And I want you to believe that, because with modern science, new treatments are being developed. And I think there's great opportunities now to finally change the direction where we can offer patients, not just longevity, but also a good quality of life.
Yes, hope. And I thank you, Dr. Javle, for being part of that, making a difference. Like I always say, getting involved with, organizations and providing your expertise to them. I really appreciate that.
Thank you for your wonderful work, Debbie.
Thank you guys so much for tuning in today to the On Air Advocate. If you guys want to know any more about the On Air Advocate, you can head on over to onairadvocate.com and find all of our resources there. And from this show, we will drop below, whether you're watching this on social media or on the podcast, the web link so that you guys can check out all of the information. Thanks so much. Bye-bye, everyone.